eNMD is a congress that is related to e-health and innovation to overcome barrier in neuromuscular disease. When we wanted to organize, at the beginning was a very small meeting, and then it became larger and larger because a lot of people were interested. And we also understood during the organization that patients are really interested in participating to this meeting.
Overall, we represent the voice of the 30 million people living with rare diseases, and our role is to advocate for the better diagnosis, better treatment, and better care, holistic care of patients living with those diseases.
The ERN is the European Reference Network. So this is for healthcare of patients with neuromuscular disease in Europe. Comprising a total of 64 hospitals that look after a total of about 100,000 patients with neuromuscular disease, and they are supposed to provide better cross-border health care.
The association AFM Téléthon is very supportive to the e-health and innovation because it's very important for all the patients. We have a lot of unmet patients' needs, and the innovation on e-health is the best to answer on these unmet patients' needs. For example, tools at home, telemedicine, teleassistance.
When a study ends, a lot of patients tend to just stop doing the exercise, and I think having these tools will enable us to keep the patients motivated, feel that they are not lost.
From the e-health and innovation perspective, activity monitoring and monitoring how a person moves with IMUs and wearables is a growing field, and everybody's trying to validate that.
Our devices is thought for the blind, not for generally for handicapped people. And now we are providing the blind information similar as what the sighted people can obtain simply at a glance. They can manage to plan their navigation through rooms in a similar way as sighted people can do. So they can be more autonomous, they can be more self-confident.
Nowadays we have better devices that can catch more precisely the changes that happens in the muscles of patients. So both in acute changes and chronic changes. So we have new tools to follow up patients during natural history studies or even in clinical trials.
At the moment there is a development of many tools that we call exoskeletons or wearable robotics, and then this opened a new era for rehabilitation. And then we are thinking to create a new center where the patients are assessed, and so we are able to evaluate their motor abilities, and then depending on their motor abilities we can send them to one particular exoskeleton.
The IDEX initiative it's a competition in France which is supposed to detect which are going to be the 10 universities that are going to be intensive in research in the future. This means in the universities where the money of research is going to go. So it was very important to be part of this selection, and actually we got it in 2016.
And we'll learn a lot during this meeting about those new technologies, various aspects, how we can follow patients, how we can educate both patients and clinicians, how to handle the patient journey. The future starts now in this meeting.
C'est une première édition du eNMD 2019 et j'espère qu'il y en aura beaucoup d'autres.
Moi je voudrais souligner qu'il y a aussi de l'innovation justement dans tous les traitements des maladies rares et donc c'est aussi ça qu'on veut mettre en avant lors de ce congrès.
Ce n'est pas un beau défi, c'est un excellent défi et c'est une très bonne image pour Nice et la région niçoise.
For next year, the events related to the e-health in neuromuscular diseases is foreseen in Pisa, Italy, for the dates of 20th and 21st of March. We think that this will be an occasion in which to exchange experiences we have made in the first event we have just conducted in Nice, and to expand some of the topics that are being considered in this first occasion.